It's my pleasure now to introduce and welcome Gabriel Alcoba, who is very well known in the MSF family as the other member I mentioned before. Gabriel is the leader of MSF NTD working group, and he will give us a presentation about them. So I invite Gabriel on the floor, and Gabriel, the floor is yours.
Yes, thank you so much. It's really great to be here today with all of you and to see so many people interested and participating in the fight against neglected tropical disease and against neglect. And talking after Mulikat and Valentina, I mean, it's just fantastic for us today. And the next speakers you will see really amazing. I will just like to introduce you the topic of neglected tropical diseases, which is very close to my heart, and I've been working on this for almost 10 years now. And usually I'm a clinician, but this is today a bit more about the strategy on neglected tropical diseases. You see, we have a neglected tropical disease working group. And it is very much overlapping pediatrics. Indeed, 1 to 2 billion people are affected by neglected tropical disease. Half of them are children. And they are usually neglected. I mean, why do we talk about neglect? Because they are almost eradicated or forgotten in rich countries. And on the other hand, they affect disproportionately the world's poorest, the most remote populations, rural displaced populations, and they're very much neglected by pharma and academia. They share a few common clinical features that Jaap and Valentina will present this afternoon in the workshop, if you can attend. And they often affect the skin. There's often malnutrition, diarrhea, anemia, acute and chronic pain, visceral involvement like liver and spleen, and often as well neurologic or psychiatric, like sleeping sickness. This is list of the neglected tropical diseases, the official list of WHO, and this list is actually of 20 diseases. Snakebite was added in 2018, and we really hope to have NOMA very soon. You heard Mulikat before, and you will hear a bit later a bit more on NOMA. It is these are truly examples of neglected tropical diseases that are not necessarily infectious. So as we saw, the definition is not about parasitic or bacteria. Many of them have been parasitic diseases, and the traditional ones since the past 30 years have been American and African trypanosomiasis, leishmaniasis, and schisto more recently, as you saw in the previous example. Also bacteria like Buruli ulcer that are very stigmatizing and disfiguring, dengue fever and rabies, which are viruses, and you also have some deep mycosis like of the foot and skin, like mycetoma and chromoblastomycosis that nobody has heard of most often until very recently. These are some success stories of the WHO. I'm not in WHO, but I mean, we have to really salute the progress and fantastic coordination on neglected tropical diseases lately. Yours is starting to really disappear progressively. Others like sleeping sickness as well. And on the other hand, echinococcosis, thanks to access to ecography, is really being picked up much more often, and we are seeing this progress as well in MSF. So which NTDs do we treat at MSF? They are most of them are very much pediatric, especially leishmaniasis, which affect more than 10,000 people in MSF every year, MSF hospitals, and snakebite and venoming almost as much, more than 7,000 now. It's really growing a lot. Dog bites and rabies prophylaxis, schistosomiasis increasing as well, digestive parasites, dengue fever, NOMA, and Buruli ulcers. And these are some numbers that you can see, and with the country distribution done by Epicentre every year in the typology with Kala-Azar and other cutaneous leishmaniasis and snake bites affecting many countries in Asia and Africa. So the strategy, of course, there's a strategy at WHO. We also have a strategy in the NTD working group here in MSF, and it started about 30 years ago. And first it was on these parasites, and now we are including many different types of diseases, which are mostly driven by the neglect of the population, the type of disease, which is really completely neglected by the academia disproportionately. And now there are also more partners like the NNN, which is the NGO NTD network, and also national experts in many countries where there are NTDs. We saw Nigeria for Noma, there is Kenya for snake bites, and many others. So we are moving away from vertical approaches of one disease at a time, except in cases of outbreaks, like there were some outbreaks in the past, but more into a transversal quality approach, improving detection, improving quality of detection and care, having a minimal package. We'll hear about One Health later with Lachlan and Corey, and persistent fevers. We talked about fevers of unknown origin before. There is something in the new pediatric guidelines, and we are also developing very good tools to work together on this. And of course, we're continuing to work on advocacy and access and a bit of innovation on rapid tests and other tools, and a lot of advocacy, as you saw on NOMA. Voila. So the syndromes are quite varied. They are from fevers, malnutrition, anemia, skin NTDs, you saw, and the strategies are also quite multiple. We can combine them, and we can use them in different contexts, from mass administration, which requires quite a lot of logistics, to intensive innovative treatments, which has required access to these more complex treatments like antivenoms, anti-leishmanial drugs, which were sometimes complex to acquire and to combine. Vector control and WASH is really improving, and active case finding, social mobilization, One Health, working with veterinarians is something that we are really promoting. It's not always easy for neglected diseases, but it's really picking up. So just 3 tools to finish with. These tools, one is by the WHO, it's a skin NTD app to recognize the main dermatological neglected diseases, disfiguring, stigmatizing diseases. There's also a new Tembo e-learning for snakebite envenoming and how to use antivenoms and the side effects, etc. And we're working on persistent fever algorithms. For those who are in MSF, it's in SharePoint, it's not completely open, but there's also a pediatric guidelines, as you know, with a summary of persistent fevers and parasites and other tropical bacteria that cause fevers that we are working on. So this is the Skin NTD app by WHO. Really, it's a moving tool that integrating a lot of learning material by different NGOs, and also improving artificial intelligence recognition of skin diseases, which is really interesting. This is the new Tembo snakebite and antivenom e-learning, which is open for also outside MSF. And for the persistent fevers, we started developing this after we saw that many persistent fevers were not Calaza or not Leishmaniasis in Sudan. And we found these 6 other bacteria, brucellosis, borreliosis, leptospirosis, rickettsiosis, and enteric, which is typhoid fever, on top of the usual suspects, TB, HIV, pneumonia, UTIs, and pelvic inflammatory diseases. Finally, it was published this year, so at last we have some evidence to work on this, and I won't go into details. There is an algorithm, it's an ongoing work, it can be adapted to every country, but we want to talk and to tailor make it with the actors in the field. Overcoming neglect, this was a publication of last year, and this year one of the very good news was the Kigali Declaration on NTDs, by many leaders, many heads of states as well, and also by MSF International. Daniela was there, and there was a declaration, and we're really happy to reiterate the commitment of MSF to treat neglected tropical disease and population suffering and affected by neglected tropical diseases. And That's all. On advocacy, as you know, we work hand in hand with the Access campaign. This was on access to antivenom and on traditional medicine for snakebite, like frogs or urine or other tourniquets that can be harmful. So this is on the MSF Access campaign. And you already know quite a lot about NOM, and you will hear a little bit more a little bit later after Moulika's presentation, and Claire will talk as well. So really, I encourage you to go and see all the presentations on neglected tropical diseases. And thank you very much for your support. Spread the message, stop NTD neglect, and come to the E-round this afternoon if you can. Thank you very much.